In this video we review the OrthoView General Process for trauma planning. In Examination Panel, choose the Fracture Management icon and go to the long bone of interest, choosing the particular fixation device required. The default prosthesis for this procedure appears. Choose from the images available or use the Shift or Control key to select more than one. Open your images and scale. Be careful when scaling the lateral extremity image to choose the correct mediolateral or lateromedial X-ray direction. Once scaled, both images will be pushed into the reduction screen automatically. Reduce both images, remembering to use the zoom, contrast keys, properties of the reduction tool, and to use the reduction tool as many times as you need it. Go to templating when reduction is complete, and the template chosen will appear. Looking at the AP image and the positioning of a plate, click somewhere on the template, drag the 4-point handle to a place where the top of the plate should start, and then take the arrow handle and drag the entire plate to sit alongside the bone where it's needed. Dragging it further will increase the length of the plate. Individual screws can then be adjusted to suit, or screws can be removed by right-clicking on a screw and going to the Properties box. If you choose Type, No Screw, insertion order can also be added to each screw individually. Both the AP and LAT view can be shown at the same time, and any adjustment made on one view will be automatically reflected on the other, such as length of screw or insertion order. Right-click to select the Properties box and select the order required. Straight plates are able to be bent in the AP view. Selecting Start Bending introduces a number of yellow handles. It is suggested to start at the top and work down any curvature in the bone. In this case, no curvature is particularly required. However, expanding the AP image, if it was, just move the yellow handle and it moves the flex point above it. This is recorded in the report. Now let's review how we would trial a nail instead of a plate in this session. Firstly, hide the plate and do this on both images. Then go to Add New Procedure, Fracture Management, and choose a nail instead. Select whatever is required and add the procedure. The nail then appears on both screens. If we look at the AP first and begin by reducing the length just for easier manageability, click on top of the nail and drag to the expected positioning point and take the arrow in a similar way to the plate and drag and extend as needed. The selection of length can also be done in the template selection area, and trial different diameters until a suitable selection is made. Once again, screws can be adjusted, this time side to side, and also removed by right-click and use of the Properties box. If we now look at the lateral view, everything is reflected in both views, and because this image is cut off at the ankle end, it's easiest to use the right click to rotate the nail into the correct position and use the length as determined in the AP view. The screw again can be adjusted, as this one can only be seen in the lateral view. An equivalent at the ankle exists if this part of the bone is visible. Choose to keep either the nail or the plate procedure and delete whichever is not required for clarity. then save or commit the images. This ends the tutorial on trauma templating.